Hi, I'm Jill Smith, and I'm here today to talk to you about the 8 rights of medication administration. These 8 rights are really important in correct and safe medication practice for nurses and ensuring that we practice safely at this very vulnerable time for our patients. So let's talk about the first one. The first right is the right patient. So for the purpose of this video, let's talk about Susan as your patient, and she's in for surgery. So you go into the room and Susan's having pain, and you want to give her analgesia. So you need to identify that actually the order you have is for the right patient. So ask Susan who she is, and she needs to tell you her name, and you confirm that with the order and her armband. Those are your 2 patient identifiers, which are really key. In some organizations, we actually do have things like barcode scanning, which actually keeps us safe in our practice, but that's not everywhere, so it is important to make sure you identify 2 different ways. The second one is the right medication. So is the medication that you have in hand for Susan the right, does it match the order that you have? The third one is the right dose. So does the dose fit? Is it appropriate? Does it match the order? And knowing the dose, if it's children, you may want to do dose calculations based on weight base. So everywhere we hate, but it's always coming back to the math. The next one is the right route. Is the route that's chosen in the order the appropriate route? So again, when you reflect on Susan, so she's having nausea and vomiting due to severe pain, and your medication is ordered orally. Is that going to be good enough for Susan? Do you need to think about subcutaneously or intramuscularly, or even to the point of intravenously? But also knowing that whatever route you use, is it supported in your organizational policies and your PDAMs through pharmacy? Then you look at the right time. So medications are ordered on frequencies. So once a day, twice a day, Q6, Q4. So this analgesia, is it ordered every 4 hours or every 6 hours? And when was the last time it was given? So you need to go back and look at the documentation to see when it was last administered. Then we look at documentation, the key point of it all, making sure that we write down and document on the patient's chart what we gave, how we gave it, and the amount that we gave. So the drug, the dose, the route that you have administered. Then, when you're giving medications, also know that you're giving it for the right reason. Looking to see, is the medication that you're giving, does it fit what the patient and what their needs are? And the 8th right, which is really, really important, is the response. So the medication that you've given Susan, did it work? Is Susan pain-free? Is she had a decrease in her pain, and has that helped alleviate things for her? And that's your big component. So that is a quick little rundown of the 8 rights of medication administration. I hope this is helpful for you in your clinical practice to ensure that you administer meds safely. Thank you.